you ever wondered why nearly half of all adults develop high blood pressure, yet many never feel a single symptom until it's too late? High blood pressure, also known as hypertension, is often called the silent killer because it can quietly damage your heart, your brain, your kidneys, and blood vessels for years before you even know it's there. I'm PA Eric, and I've spent years practicing primary and urgent care medicine, and before that, I worked for Novartis Pharmaceuticals promoting medications used to treat hypertension. So I've seen and treated high blood pressure from both the pharmaceutical and patient care side. But here's what may surprise you. Some of the most dramatic blood pressure improvements I've seen in my patients didn't come from medication. I've personally helped patients reduce, and in some cases completely eliminate, their blood pressure medications through exercise, weight loss, and healthier lifestyle habits. Today we're going to talk about what blood pressure actually is, why it matters, and most importantly, what you can do to improve it naturally before we ever discuss medication. Let's dive in. It's the channel dedicated to health, fitness, longevity, and aquatic adventures for folks over 40. Welcome back to Motion Over Medicine with your host, PA Eric. Welcome back to Motion Over Medicine. If you're new to the channel, I'm PA Eric, and my goal is simple. Help folks over 40 stay healthy, active, and independent as long as possible using fitness, nutrition, and practical medical knowledge. I also take you on the occasional aquatic adventure just to make sure my body is keeping up to speed with my adventurous spirit. Today's topic affects millions of Americans and is one of the leading causes of heart attacks, strokes, kidney disease, and heart failure. The good news? For many people, hypertension is highly preventable and often highly reversible. Let's start with the basics. So, what is blood pressure? Every time your heart beats, it pushes blood through your blood vessels to deliver oxygen and nutrients throughout your body. Blood pressure is simply the force of that blood pushing against the walls of your arteries. When you get your blood pressure checked, you get two numbers. For example, 120/80. The top number is called systolic pressure. That's the pressure generated when the heart contracts. The bottom number is called diastolic pressure. That's the pressure when the heart relaxes between beats. Generally speaking, 120/80 and below is considered normal. 120 to 129 systolic is elevated. 130/80 and above is considered hypertension. The higher those numbers climb, the harder your heart has to work. And eventually, that extra strain starts causing damage. So, why is high blood pressure dangerous? After talking to thousands of patients about their blood pressure, I've noticed most people are not aware of the true dangers associated with hypertension. Let's clarify that today. One of the biggest problems with hypertension is that most people feel perfectly fine. No pain, no symptoms, no warning signs. Meanwhile, elevated blood pressure is slowly damaging blood vessels throughout the body. This is why high blood pressure is deemed the silent killer. Think of it like running excessive water pressure through your home's plumbing system for years. Over time, your home's plumbing and fittings would wear down, seals would lose their integrity, and the next thing you know, however, when blood pressure in the human body is increased over time, it's not your faucets, water heater, or shower head that's at risk. It's your brain, your heart, your eyes, your kidneys, and blood vessels. In addition, high blood pressure over time causes blood vessels to get stiffer, plaque to develop more easily, the heart muscle thickens, the kidneys become damaged, and the risk of stroke increases dramatically. This is why blood pressure matters so much. Not because of how you feel today, but because of what it can do to you, slowly and silently, over the next 10, 20, or 30 years. In medical training, we discuss trying to prevent end organ damage when we treat blood pressure. In other words, preventing damage to your brain, heart, kidneys, eyes, and blood vessels by controlling the amount of blood pressure delivered to them every second of every day. Many people think hypertension is simply bad luck or genetics, and genetics absolutely do play a role. But in most cases, lifestyle plays an even bigger role. The most common contributors include excess body weight, physical inactivity, high sodium intake, poor sleep, excess alcohol consumption, chronic stress, smoking, and unfortunately, simply getting older. Notice something? Most of those factors are modifiable. That's actually good news, because it means there are things you can do about them. If I could pick one intervention that consistently produces dramatic blood pressure improvements, it would be weight loss, especially for people carrying excess abdominal fat. Fat tissue is not just sitting there, it's metabolically active. It produces hormones and inflammatory chemicals that contribute to elevated blood pressure. The more excess weight you carry, the harder your cardiovascular system has to work. The encouraging part is that you don't need to lose 100 pounds to see benefits. Many patients experience measurable blood pressure improvements after losing just 10 or 20 pounds. I've seen patients who required medication at 250 pounds that no longer required medication at 210 pounds. The body is remarkably resilient when given the chance. Now let's talk about my favorite intervention, exercise. Exercise improves blood pressure through several mechanisms. It strengthens the heart, improves circulation, reduces inflammation, and improves insulin sensitivity. On that note, if you haven't yet had a chance to watch my video regarding type 2 diabetes, this video covers the importance of increasing your insulin sensitivity, so check it out. Obviously, exercise helps with weight control. The best part? You don't need to become a marathon runner. For most people, brisk walking is enough. Aim for 150 minutes per week of moderate cardiovascular exercise. That's about 30 minutes per day, 5 days per week. Walking, cycling, swimming, rowing, anything that gets you moving. Resistance training, such as weightlifting, helps as well. Building muscle improves overall metabolic health and can contribute to healthier blood pressure levels. Remember the name of this channel, Motion Over Medicine. Movement truly is medicine. Now, let's talk about food. One of the fastest ways to sabotage blood pressure is a bad diet filled with processed foods. Processed foods are often loaded with sodium. Many Americans consume far more sodium than they realize. The biggest offenders aren't usually the salt shaker. It's restaurant food, frozen meals, snack foods, fast food, processed meats, and packaged foods. Instead, focus on lean protein, vegetables, fruits, beans, whole grains, and healthy fats. The closer food looks to its original form, the better. A simple rule: if it grows from the ground, swims in the ocean, or walks around on 4 legs, it's probably a better choice than something manufactured in a factory. Here's a topic that doesn't get enough attention: sleep. Poor sleep can significantly increase blood pressure, particularly in people with sleep apnea. If you snore loudly, wake up exhausted, or fall asleep during the day, discuss sleep apnea with your healthcare provider. Treating sleep apnea can produce dramatic blood pressure improvements. Stress also matters. Stress hormones increase heart rate and blood pressure. No, eliminating all stress isn't realistic, but regular exercise, adequate sleep, hobbies, time with family, and relaxation techniques can help. For 4 years in pharmaceutical sales, I specialized in cardiology, so this subject is near and dear to my heart. Let's talk about treating hypertension with medication. Because despite what some people might think, medication absolutely has an important role in hypertension. I'm a huge advocate of diet and exercise, but for those that are generally predisposed to high blood pressure, medication can absolutely save their life. The same can be said for those with physical disabilities, injuries, and those who may not have the ability, resources, or wherewithal to lose weight. Some people have severe essential hypertension. We call it essential hypertension because we can't point to one specific cause. This is different from secondary hypertension, where we can link high blood pressure to a specific condition. Others have strong genetic predispositions. Some patients already have heart disease, kidney disease, or diabetes. For these individuals, medication may be necessary and potentially life-saving. There is no shame in taking blood pressure medication. The goal is not to avoid medication at all costs. The goal is to use the least amount of medication necessary while maximizing healthy lifestyle habits. In many cases, lifestyle changes reduce the amount of medication required. In some cases, they eliminate it. And in some cases, medication remains necessary despite excellent habits. That's okay too. The objective is lowering risk and improving health. If you remember nothing else from today's video, remember this. High blood pressure is common. It is dangerous, but it is often highly responsive to lifestyle changes, and there are amazing medications that can assist with controlling blood pressure. Lose excess weight, exercise consistently as tolerated, improve your nutrition, prioritize sleep, manage stress, and work closely with your healthcare provider. If you're not visiting your primary care provider at least once every 6 months for a standard checkup, you should start. Now, here's a tip to help you and your primary care provider out. We can't reliably treat your blood pressure with one reading taken in the clinic. If you're concerned about blood pressure, purchase a blood pressure cuff at your local pharmacy. A good one can often be purchased for less than $100. This is an excellent item to have around your house in general, but here's how you can help out your medical provider. Take your blood pressure twice a day, once in the morning and once in the evening when you're at your most relaxed. Keep a log writing down the date, time, and the blood pressure on each occasion. Bring your primary care provider 10 to 14 days of this data, and he'll love you for it. The average of these readings can reliably tell us what your blood pressure is, allowing us to treat you with medication appropriately if required. All of these simple steps can dramatically reduce your risk of heart attack, stroke, kidney disease, and premature death. I'm Eric Fergan, and this is Motion Over Medicine. If you found this video helpful, hit the like button, subscribe to the channel, and share it with someone you care about. Because sometimes the best medicine isn't found in a bottle. Sometimes it's found in motion. See you in the next episode.